Welcome again to my class. I am Dr. Shaurik and I am explaining the organ of medicine in a very simplified manner. It is obvious that we need to know Hahnemann's words from the organ of medicine. Obviously, we can read anything from anywhere as per references, but from the organ of medicine, if we read properly, it will be magical. We can see that in many of the cases we generally skip aphorisms sometimes one after another. Particularly, I am telling about the students because this lecture is not for laymen. These lecture are for the professionals, the students, or sometimes the practitioner who already know have the full of knowledges. But still, sometimes it requires to recap the organ of medicine. So let us start. This is the organ of medicine which I study or which we need to study from Hahnemann's aphorisms translated by Adi Dajan in the 5th edition and William Borick in the 6th edition. This is the first page and Audi Sapir. Dare to be wise. Today we will study aphorism number 3. And see, today my motto is that we will study aphorism number 3 from the aphorism only, and how magical it is if you can extract the things from aphorism number 3. Because for the students, when we generally go through aphorism number 3, or we generally do not study aphorism number 3, we study in such a manner that the qualification of physician or requisite qualification of physician, and we go to the reference books, and there it is written that the physician requires so and so and so and so qualities and qualifications that is given in aphorism number 3, 4 and 6, etc. And we generally the students read 3, 4 and 6 in a total only point wise, but I think so that we should do that for our examination. It's okay, but exactly what is in aphorism number 3? Sometimes the main points we get, sometimes we miss something if we do not read the aphorism. So today we'll go only with aphorism number 3, although I will tell you that what is written in the reference books, that is the qualification of physician. And if we study aphorism number 3, aphorism number 4 and some sort of aphorism number 6, we will get the qualification of physicians. Now when we see aphorism number 3, we see that this aphorism number 3 gives us something which is the qualification of physician, the what the physician need to know, or what qualification the physician requires to make a perfect cure, or to do the job of a physician, the work of a physician perfectly. In the previous aphorisms, from aphorism number 1, we get that aphorism number 1 is what the physician needs to do, what is his duty, what is his mission, that is to cure. And what is the cure that is given is aphorism number 2, that is the what is the highest ideal of cure. Now to make this cure, we the physician required to have certain qualification, and this is written in aphorism number 3. Now let us study aphorism number 3 and let us find out some points in aphorism number 3 which generally the students only read in their reference books. So let us start. See, now if the physician clearly perceives what is to be cured in disease, this is aphorism number 3 right from the book of Organon. So if the physician clearly perceives what is to be cured in disease, that is to say, in every individual case of disease, knowledge of disease indication. This first line, this first line, uh, this first line of aphorism number 3 is one of the main thing which the physician needs to know. Which first line? Generally, yes, what you are seeing, that knowledge of the disease. Sorry, I will come there later. The first line is that if the physician clearly perceives what is to be cured in the disease. So if the physician clearly understands from within, if he clearly not only observe, not only examine, if he clearly perceives, this word is most important for a homeopathic physician. We just not go with the pathological test, we does not go with just the words of the physician, word of the patient, we get a total symptoms, the subjective and objective symptoms, the totality of the symptoms, the mental conditions, the all the mental and physical aspects of the patient, and we understand what is to be cured in the disease. A patient may comes to you to cure some acidity, but is that the acidity which the patient required to cure? If we go to the point of individualization, we can understand why this acidity is occurring, what are the main symptoms, what are the keynote symptoms, what are the characteristics, what are the historical background of illness of this patient, and how to cure this patient so that the acidity completely cures. So we are not treating acidity, we are not treating malaria, typhoid, etc., etc., for following the nomenclature of the disease. We treat the patient, and if we can understand what is to be cured within the disease, because you see, we cure the disease, but what this line is telling, what is to be cured in the disease. So there, what you need to do in the patient, it requires. Once I can give you one example. Once I got a patient. He was a very robust and good build up body, a policeman, and he used to work in a section where there is a lot of criminals, etc. That person, and I tell you, by that time I was just an intern. I was not. It was a long back. I remember that case because he was complaining of acidity and indigestion and reflux of the water brush, and this type of many GI problems he was taking. He was having, and he came to our hospital at Mahesh Bhattacharya Homeopathy Medical College. This is a government college which I have studied, and by that time it was till now it is one of the best college having the large amount of patient in the OPD. And this patient, he was complaining of all these. I was taking the case, and in his past history of illness and treatment, he was telling that he has taken all type of allopathic medicine, Rantac, Gintac, that is, he was telling that I am taking it like anything else, like snacks. I take Rantac, Gintac, and I'm fed up of it. I'm not putting down any other system of medicine, but the thing is that it deals with the skill of the physician, how the patient should be treated, or it deals with the proper what we can say, the law of treatment. So the patient, he was telling that he was fed up with allopathic medicine. He has taken a lot of Ayurvedic medicine, and he took a lot of homeopathic medicine also, but he was having no result, and he was suffering from this type of acid reflux, etc., GERD, for a long 7 to 8 years. Now he has taken Carbovage, Natrum Phos, and many type of homeopathic patents, etc., and he was not getting any result. uh, I was taking the case. I was not so much knowledgeable, how much knowledge an intern can have, but I was trying to take a complete case, because this was a chronic disease. It was 7 to 8 years long. He has taken a lot of medicine, etc. And regarding his mental symptom and etc., I was asking about his personal life, many things, and that patient, he literally cried, he outbursted in front of me, and he was telling that one of his niece who has been murdered by, it was about a year ago, and it was very shocking to him, and everything turns topsy turvy, turns upside down after the death of that child. She was about 12 to 13 years old. I did how much, that much I remembered, and he was so much shocked, and everything in his life has turned into something different. And this type of disease, which was having started from there, I was not having so much knowledge. I was not, but one thing I marked, that this patient was so much affected by that shock. I had given him Ignatia, and magically, after 1 week, the patient came, and he told that, sir, it is working marvelously, and I am still having something, but it is working. I am okay. And after about 1 month, I had given him placebo, and after 1 month, he came again with a complete relief. Thereafter I told him that you please call me if the condition returns, but he told that till since the last 7 to 8 years I was not having this type of relief even after 2 months. So you see that what is to be cured in the disease, which is one a very simple and general example where homeopathy works. It is not my skill, it is not nothing that, because I am repeatedly telling, as an intern I was not having much knowledge, but in Ignatia that is written here that after shock, any type of disease or any type of condition which appears after this type of mental shock and sorrow, it works, this medicine works, and I have given that thing. This is the magic of homeopathy. And when we are as a physician, we try to know what is to be cured in the disease. That is, in an acidity, if you try to cure only acidity, I think so that you have to search for something else where it is not the acute case or it is not having some critical exciting cause. I will discuss about this treatment following the cause and the disease, the cause and effect phenomena, and how to treat the patient accordingly in some separate video, because this will go longer. This video, because we are studying aphorism number 3, but this first line of aphorism number 3 is most important. If the physician clearly perceives what is to be cured in the disease, so this is not any point which is to be written in your examination, but this is the thing which we have to understand when we will become a doctor. Okay, now let us continue the aphorism. Okay, so we have the next line. That is to say, now what is the physician's qualification, what he needs to know? In every individual case of the disease, knowledge of the disease, comma, indication. Now knowledge of the disease indication, if you are sitting with a notebook, you can note, this is point number 1, knowledge of disease indication. That is, the physician must know about the knowledge of the disease. He must not know about only the nomenclature of the disease. Knowledge of the disease, what does it mean? Knowledge of the disease means the knowledge of the symptoms of the disease, knowledge of the complications of the disease, knowledge of the origin of the disease, and how the disease is occurring within the body according to the susceptibility of the body. How the disease, in what conditions, what hygienic conditions, what environmental conditions, what are the causes of the disease in the particular case, and what type of treatment which we have to give, and what type of lineup, what type of deficiencies which is creating the disease. So all the type of the cause of the disease, all the type of the dynamic effect of the disease, all the clinical symptoms of the disease, and all sort of complications of the disease, we must know the knowledge of the disease. This knowledge of the disease does not indicate to have the knowledge of disease just like whatever is written in the practice of medicine or surgery book. This knowledge also includes the knowledge how this disease is caused, what is the dynamic effect of the disease, and why the disease is acting on this person. So this is one of the very important thing which is regarding the knowledge of the disease, comma, there is one word, that is the indication. Now we know the knowledge of we know about the disease by the symptoms. We know about the disease by its expressions, not by its name. There is no medicine for malaria in homeopathy. There is medicine for such and such type of shivering during the fever, such and such type of thirst, such and such type of conditions of mind during this fever, and there on the basis of totality we give a medicine. So we do not give a medicine according to the name of the disease. So this is very important for us, the word indication. That is, when we have the knowledge of the disease, we must have the knowledge of the proper indications of the disease. Next, if he clearly perceives what is curative in medicine, that is to say in each individual medicine, in within the bracket knowledge of medicinal power. So a physician, just like he is having knowledge of the disease, he must also know the knowledge regarding the medicine. What knowledge regarding the medicine? Not the color or contour of the medicine. He must have the knowledge regarding the power of the medicine, what the medicine can do when it is applied within a living organism. So this is the knowledge of medicinal power, which we can acquire by means of our drug proving, which is given in aphorism number 105 to 145. Now, so this is point number 2. So point number 1 is knowledge of disease indication. Point number 2, knowledge of medicinal power. Now point number 3, if he knows how to adapt according to clearly defined principles what is curative in medicine to what he has discovered to be undoubtedly morbid in the patient, so that the recovery must ensue to adapt it. So the physician has the knowledge of the disease indication, he knows the knowledge of the medicinal power. Now he must have the knowledge of applying his knowledge of the disease, knowledge of the medicine to the knowledge of the disease. That is, we can say, the application of drug knowledge to disease knowledge, which is generally written in our reference book in the points. So this is the third point, to how he can adapt or how he can use his knowledge of the medicine in the particular case of the disease he is having in front of him. This is the point number 3, knowledge of application of drug knowledge to disease knowledge. Okay. Next point, as well in respect to the suitability of the medicine most appropriate according to its mode of action to the case before him, that is the choice of the remedy the medicine indicated. This is point number 4, that when he is applying this medicine, according to this point number 3, when he is applying this medicine, this knowledge of medicine, it is very important to have a proper or correct choice of the remedy. So you must have, because when we give a medicine, there are many things, many symptoms, or in a patient, the patient is telling a number of symptoms which is indicate a number of medicine very closely. Suppose our patient having some fever, having some cough and cold with it, and having some headache and etc. He is having, and he is telling these symptoms, and it is very close to belladonna, bryonia, arsenic, etc. 3 to 4 medicine you are getting confused of. Okay, so you have to make a correct choice of the remedy, and this is the point number 4, that is the knowledge of choice of remedy. Next, as also in respect to the exact mode of preparation and quantity of it required, that is the proper dose. So next point is that as also in respect to exact mode of preparation. So you need to know the mode of preparation. Present in the present day, we generally have a very less knowledge regarding the preparation of medicine, because the medicine, it is mostly it is prepared in the factories and is supplied in a marketing method, and it is where the physicians are getting that. Many of the medicine, the good physicians always know the source of the medicine. During Hahnemann's time, the medicines are made by themselves, and they potentize themselves, and they used to dispense to the patient. It indicates that we must have a clear, undoubtedly we have to give the patient a genuine and correct, unadulterated, pure medicine. So we must have to know the knowledge of the preparation of medicine, because sometimes it is very astonishing when you see, when you are using sometimes we use the mother tincture, and some mother tincture have the typical colors, and often we get that the color is not matching if we have the knowledge. That is a separate matter of controversy. We are talking about something, the question is arising, but still you see that you need to know the knowledge of the proper preparation. Whether you are preparing it or not, it is a separate matter, but from where you are collecting, or from where, or what type of mode of preparation, you must know for the to understand the genuinity of the medicine. So this is point number 5. Next, point number 6 is the quantity and the quantity of it required. That is, within bracket it is written the proper dose. So when you are giving the medicine, it is not just enough to have a correct choice of the medicine. You must give a proper dose, which is very, very important. Overdosing might cause difficulties and might cause the extra symptoms which is present within the medicine, that is called medicinal aggravation. And sometimes the correct potency, if we cannot prescribe, it is also making very difficult to cure the patient. So choice of remedy is not only the only method to cure a patient. we must know the dose of the medicine, how much or is to be given to the patient. Next point, point number 7, and the proper period of repeating the dose. It is written here. So dose, after dose, the next point is repetition of dose. Repetition of dose, very very important, very very important. And dose and repetition of dose, you see that suppose you see a medicine, listen very carefully. Suppose you are giving one patient cornea maculatum 1m. Now why this 1m, why not 30? That is the knowledge of the dose. And how, after how long it is repeated, or how much dose you are giving. Cornea maculatum 1m twice a day for 15 days, odd prescription. If this type of prescription is there, it is not a good one, because it is not following the minimum dose. And again, if we go to the repetition in acute disease, in chronic disease, regarding this point, Hahnemann has given us clear instruction of how long or in what interval the medicine is to be repeated. In the 50 millisimal scale, that is something different. The repetition is totally different than the centesimal scale. That will get details when we will discuss regarding the dose and its repetition in later aphorisms, aphorism number 248 and etc. So here we get, till now we are getting these 7 points, that is till now we are in the point of repeating the dose. So we must have the proper knowledge of repetition of doses, otherwise dangerous effect can be had. We should not be very easy that homeopathic medicine does not do any harm. That is not a correct sentence. Homeopathic medicine has no side effects. It acts on the organ where it is affected, where the organ is affected, but it has no separate other effect. But if you give homeopathic medicine in a larger dose or unnecessarily increased doses, it can do harm. So we should be very careful. Next point, if finally he knows the obstacles to recovery in each case and is aware how to remove them so that the restoration may be permanent. So this is point number 8, obstacles to recovery and how to remove them. So you have given a medicine, you have selected correctly, you have given a proper dose, you have repeated the dose, but the patient is not recovering, or the patient is not getting cured. Where you have to look after? You have to look after the obstacles. What are the maintaining causes, or what are the causes which is not curing the patient other than your medicines? So this you have to make it sure from the common sense of a physician. So if all these qualifications are present, then he understands how to treat judiciously and rationally, and he is a true practitioner of the healing art. So he is a true practitioner of a healing art if he have all these type of knowledges. So I can repeat once. So you see one thing, I am taking out the points from this aphorism number 3 very easily in the last 15 minutes. Point number 1 is knowledge of disease indication. Number 2, knowledge of medicinal power. Number 3, knowledge of application of drug knowledge to disease knowledge. Number 4, knowledge of choice of remedy. Number 5, knowledge of preparation of medicine. Number 6, knowledge of dose. Number 7, knowledge of repetition of dose. Number 8, knowledge of obstacles to cure and how to remove them. If the physician have all these knowledges, he is then a true practitioner of healing art. But above all, we must, with the physician, must clearly perceive what is to be cured in the disease. So if you are a student of the undergraduate course, please go through this aphorism once, read it carefully, and you can have the point lying within this aphorism. Please don't go directly to the points giving this to the reference book. After reading this aphorism from aphorism number 3, you can read any type of reference book where the point is given in a ready-made condition. So another thing is that there is a short appendix in this aphorism number 3. The aphorism is an expansion of in this sentence in the medicine of experience. So medicine of experience is the precursor book of Hahnemann's organal. which was written in 1805, and there are a lot of things which resembles the medicine of experience, which is present in the organon of medicine. Finally, for the students, we get some question. Describe the requisite qualification of physician. You just go to the aphorism first. You write down how to write this thing. That in the organon of medicine, the 5th edition and the 6th edition, written by Samuel Hahnemann, he has given us a very clear idea about the qualification of the physician. There we get this qualification of physician in aphorism number 3, 4 and 6. Here I am telling about only aphorism number 3 in this lecture. We will go to 4 and 6. So you write this thing, and after that you write that in aphorism number 3 he has written so and so and so and so. We have the qualification of physician, and you then write the points in a separate manner. From the aphorism number 3 we get these points, 8 points, and explain each and every points in a very short manner. So this is this type of answer we require. And what is the significance of the word perceive in aphorism number 3? So I have described it in the very beginning, so you can write in your own words regarding that. If any other question, you please write to me in the comment box, or you can WhatsApp me in this number. We'll meet again. We are going with the series to understand the organon very clearly and very simply. Okay, till then, goodbye.